Assalamu alaikum.
Wa alaikum assalam.
Welcome to showmenewsbd24.com.
Pleasure.
We know here that your Oxybet hospital does not heart spending and surgery. So how is heart disease treatment?
See, basically, in the year 2000, we got into a collaboration with ACAM, American College of Advanced Medicine. So our team of doctors dwelled upon a main sort of a treatment which is patients cannot undergo for surgery, that we call technically inoperable group. For a surgeon, it is difficult to take all cases of surgery. For example, if there is an infection, or if the sugar is elevated, or if there are multiple blocks like carotid artery block, coronary artery block, or peripheral vascular disease. So for a surgeon it becomes difficult to perform a surgery. Besides, if the coronary artery is less than 1.5 millimeter, in the world no surgeon can ever perform a surgery. So we have started with a noble cause where inoperable group of patients we have been treating without pain, without trauma, without anesthesia, without any bloodshed. By God's grace, Alhamdulillah, with advanced technology, we have been successfully treating the patients.
Sir, follow me. How long you have been maintaining the beautiful treatment producer to therapy, and what about your successful ratings this regard?
Well, the successful ratio is ratio is basically, it is called patient selection criteria. Patient to patient it differs. That's why the diagnosis is very, very important. So when we see it is possible, patient don't select us. There are a lot of patients, they come here from abroad. We ask them to send the reports. When we see the reports, if there is a valvular disease, if there is a hole in the heart, which we don't take, it's a surgical condition. So there are certain conditions, there is limitation where surgery is only the option. At such time, we do not take the patients. During this investigation, we take such kind of a patients where 100% solution can be given.
Thank you. What are the treatment for heart disease you provide in your hospital other than therapy?
Basically, when we evaluate, patients have single vessel disease, double vessel disease, triple vessel disease, or ischemic condition. At such time, there are various FDA approved therapies that we incorporate. Apart from lifestyle modification, drug therapy, and ECP, HBOT, various types of IV infusions. So we make a holistic approach. So what is compatible for the patient, accordingly we design a protocol according to the need base of the patient.
Are the treated through therapy another disease? Cancer, diabetes?
Of course, we have a team of doctors like diabetologists, nephrologists, neurologists, gastroenterologists. Most of all these professionals are all with one mind, to treat the patient without surgical intervention. So it is no hole, no pain, and no surgery. So for example, even from neighboring countries where sugar cannot be controlled in spite of giving insulin, so our diabetologist puts CGM, a computer chip, which studies 24 hours, and he comes to know the glycemic index, when it is raising, when it is falling. Accordingly, he does the titration of the dosage. These are all the advanced method without surgical intervention. Maximum or professionals, all the team of doctors are working hard to give for various ailments without surgery.
How do you identify Check the heart block and block percentage.
Well, now the basic thing is first of all to identify, because almost all the heart patients appearance wise they look healthy, but without knowing, most of them make a mistake. If the pain is there, they always, for their comfort zone, they think it's a gastritis. So as there are certain criteria, if the patient is having BP or sugar, cholesterol, age above 40, smoker, and family history, if any one two is falling into the criteria, they must undergo a basic test. The basic test is ECG, echo, and treadmill. That gives us the indication that there is some problem with the heart. The moment when we know that there is some problem, then we go a little higher test. That test is called CT angio 700 slice. The patient does not have to get admitted. Within matter of about 2 minutes, outside itself 700 pictures are taken, and in a short time we know whether there are blocks or there are no blocks.
How can a patient get confirmed about his heart percentage of heart block size and need of therapy?
When the patient comes, the basic, when we see that the PQRST waveforms in the ECG, there are a lot of variations. Some people have arrhythmias, ectopics, tachycardia, bradycardia, and angina. During the treatment itself, we are recording 1 hour of ECG. The moment when we see there is a lot of flexibility, good augmentation, during the treatment itself, we ask them to exert, to climb stairs, to walk. So basically, they are free from angina, they can have exercise tolerance, capacity, all that. Besides that, technically, before lipid profile, after lipid profile, before echo, after echo. So we compare, we know that there is a collaterals have opened, lot of blood flow has coming to the myocardium, and patient is free from any symptoms. So we confirm, then we give happily a discharge.
Nice way. Are the patient with heart disease treated her with only medicine except therapy, stents or surgery? And if so, what percentage of block size do you consider to start treatment with therapy or other procedures?
Well, see, who does clopidogrel, aspirin, with that itself the patient can get cured. So, but if it is the proximal region and it is a calcified heart block, that is the time only we suggest treatment.
Okay, nice. Have you treated patient with stent and surgeries before? Have you treated patient with stent and surgeries before inventing the lovely procedure therapy?
Basically, the patients, when they get a pain, majority of the patient don't know that there is, without surgery, there is a treatment. Immediately they go for bypass and angioplasty. But it is not the problem with the surgeon. Normally the surgeon, they promise 10 years, 15 years. But if the calcium score is more, or if the sugar is not coming under control, even we see within 6 months or 1 year, new block comes. So at that time we call instant restenosis. So one more time surgery is not possible. So they are in search. Now again I am get the pain, I cannot undergo surgery. So they find out about oximet, and then they fix up an appointment and come. Easily we are able to open up the smaller vessels called collaterals, and because the stents, one is fixed, lifelong it is going to be there. Even if it is closed, it has to remain there. So we are working around the heart to bring more blood supply, and patients are happy that second time they don't have to go for surgery.
Good. Do you have therapy at this hospital for those who have bypass or heart attacks? do you have therapy at this hospital? And for those who have bypass or that rings.
Yes. So just now I was telling you the same thing. After bypass, certain people have a quality life for 10 years. Certain people, due to various complications, the graft fails. Within 6 months they get the pain. One more time, it is not possible. It becomes more risky for the surgeon also to perform surgery. Majority of the patient come here is that they have undergone a bypass. One more time the problem is coming. So we are easily treating such patients. But when you are able to treat such difficult conditions without bypass, as such when they come with the angiogram, we are easily treating these conditions.
Okay. How many countries in the world do you know that patients are treated through this treatment?
Well, 50 years ago, the research was started. So it's a question of life. So it has to be FDA approved, Food and Drug Administration. So USA has given a certificate, it's a safe treatment. So in New York, it's called Vasomeditech. 20 years before when I went there, that time I took a training and then I brought this technology. At that time, nobody was willing to agree because for everybody the mind was fixed. So heart means it's a surgery and angioplasty. So for 5-6 years it took because nobody knew this. Later on it became so popular in USA, in Germany, in UK, so many countries, slowly they have started. So in our country, in India, when we brought, we approached the government and government assessed it and they gave the permission. Yes, of course you can do treatment without surgery.
I think you are a successful man. My last question. Do patients from any country other than Bangladesh and India come here for treatment?
We feel thankful to Allah subhanahu wa ta'ala. We get patients from America because the treatment is available there, but it is very costly. For them to and fro also is cheaper. They stay here and come. From Australia they come, from Malaysia, from Singapore, and from Dubai, from Qatar, from Oman, Muscat. So all, and from Sri Lanka, other than Bangladesh, all these country people have been frequenting. So we designed all our system itself to treat the foreign patients. Only past 1.5 years, 2 years, due to Corona, the travel has become less. But now people have got out of the fear. Now slowly, now lot of inquiries are coming, and we are sending the visa invitations, and more patients are now likely to restart the therapy.
Thank you. The number of patients with heart disease is the increasing worldwide day by day. What is the prime reason behind this, and what should be followed to reduce the risk factor of heart disease?
Yes. Today, the lifestyle has changed, right? We go to the schools and teach the children, because earlier when you see, people used to play in the hot sun. Today nobody is playing in the hot sun, so there is a vitamin D deficiency. And then youngsters itself like to have a vehicle, two-wheeler. Earlier our school days we used to walk and go, or in the bicycle. Now it has become out of fashion. So people, first floor, they don't climb on the stairs, they go in the lift. So there is no exercise activity. Now in order to control not only heart, majority of the disease, these 5 fingers, first is BP. That has to be 120/80. Then cholesterol. So whatever the parameters for LDL, HDL, triglycerides, all that has to be maintained. Another is the sugar. Another is the food. Another is some sort of an exercise. All these 5 things you can push many diseases. 90% of the hospital will not have patients. So my message to all the world people is that you have to see your numbers. Today, nobody is scared of father, mother, teacher, not even to God. They only are scared of number. So how it is, suppose your phone bill is coming every time is 500 dhaka, suddenly it comes 5000 dhaka, you are scared. Likewise, BP has a number, sugar has a number, cholesterol has a number. So I want all the people to at least once in 6 months see your number. So before it gives you a majority of problem, you can see the number and rectify yourself and not become a patient.
Thank you so much for your interview.
Thank you.